evening. Welcome to the COVID No More virtual town hall series. My name is Abba Blankson. I'm the Chief Marketing and Communications Officer for the NAACP. I couldn't be more excited about the guests that we have on tonight's timely and vital panel on the changing COVID landscape. We are pleased to do this in partnership with the Ad Council, and we look forward to an informative conversation. If you want to support the work of the NAACP, you can go to naacp.org to stay connected. For the folks on the phone, if at any time you have a question, dial *3. It will get you in the question queue. You can still listen to the program, and it'll give you an opportunity to ask your question. If you're watching on social media, you can leave a question at NAACP. With that, I would like to introduce NAACP President and CEO, Derek Johnson. President Johnson, the floor is yours.
Thank you, Ava, and good evening, everyone. I do apologize. I am in transit, but I'm excited that we're holding this end of the year teletown hall conversation to ensure our communities are safe. When we launched these teletown hall, it was in the beginning of COVID, and we launched very strong and became one of the vital voices to ensure African Americans and other communities had quality information. In this era of misinformation, it is so important that the NAACP, with the Ad Council and all of our partners, we stand up in ways in which we can provide the information to keep ourselves, our families, and our communities safe. But I'm also proud to introduce a partner, a member, a supporter, April Ryan, who's been a voice at the White House and a voice for truth, as she navigates this star-studded panel to ensure that we fight for facts and we do away with this pandemic in our communities. April, thank you for your partnership, and I turn it over to you.
President Johnson, thank you so much for your words, and thank you so much for allowing me to sit in on this very important conversation yet again. Yet again, we're dealing with COVID, and let's talk about it at this national town hall. COVID no more. And the reason why we need to know more, the coronavirus pandemic continues to ravage communities across this nation and even around the world. With the emergence of the Omicron variant, also we have Delta still with us. New information about boosters and vaccinations for children, the landscape has again shifted. Again, listen, the landscape when it comes to COVID and what we need to do about it has shifted. Hear from these trusted voices tonight, leaders about the variants, the boosters, the vaccines, and how to protect yourself and your family. Plus, we're going to have audience questions, so be ready to dial *3 and or go to social media and go to @NAACP on Twitter or on Facebook, and even on the gram. I'm talking about the Instagram. So without further ado, I want to kick this program off with Dr. Rachel Walensky, the director of the CDC, Centers for Disease Control. Take it away.
Thank you, Ms. Ryan, for that kind introduction. I'm glad to be with you all this evening, if only virtually. The next time we meet, I do hope it will be in person. It's an honor to speak with you, our nation's leaders who are in the community, working one-on-one and collectively, raising your voices, making yourselves heard, advocating for the civil and political rights of Black Americans, including the right to equity in healthcare. Derek Johnson, who welcomed us here tonight, is no stranger to the fight to overcome our nation's racial disparities in health outcomes. When the COVID-19 pandemic began, President Johnson called for a national response to the coronavirus pandemic that was informed by existing racial disparities in health outcomes, access, coverage, and services, as well as the disparate impact of COVID-19 on African Americans and other people of color. I am in awe of the work the NAACP has been doing to inform, inspire, and protect Black Americans during this pandemic. Your COVID No More initiative is an important national resource, sharing the facts about COVID, fighting misinformation, explaining research findings on vaccines and vaccinations, answering everyday concerns such as how to safely travel and host holiday gatherings, and so importantly, making clear the impact of COVID on Black America. Please know I am grateful for your activism and for being our partners as we worked to protect the health of all Americans. We have been through a long 22 months together, and I know this is not where we hoped to be in December 2021, facing a new variant, still answering concerns about the efficacy of our vaccines, still working to vaccinate every eligible child and adult in the country. As everyone has heard, less than 2 weeks ago, WHO classified a new variant, Omicron, as a variant of concern, and we are beginning to find cases here in the United States. We're studying this variant closely, continuing to monitor its path, and are grateful to the South African government and its scientists who have openly communicated with the global scientific community and continue to share information. While there is still a lot we do not know about Omicron, we do know what prevention strategies help slow the spread of COVID-19, regardless of the virus variant. Get vaccinated. We recommend that everyone 5 years or older protect themselves by getting fully vaccinated. Everyone 18 years or older should also get a COVID-19 vaccine booster dose when eligible. Wear a mask. Everyone over 2 years old should wear a mask in public indoor settings in areas of substantial or high community transmission. Keep distanced. Everyone should stay at least 6 feet away from people outside your home and those within your home who are sick. Increase ventilation. Do your best to avoid crowds and poorly ventilated spaces. Wash your hands often and well. Be sure to wash with soap and water for at least 20 seconds. And test to prevent spread. Consider using a self-test before joining indoor gatherings with others who are not in your household. Last week, President Biden announced that the federal government will require private health insurers to reimburse their customers for 100% of the cost of over-the-counter, at-home COVID-19 tests and make 50 million more tests available free in areas of more vulnerable populations through rural clinics and health centers for the uninsured. Let me stop here and emphasize the importance of vaccinations and boosters. Although the news is focused on Omicron, we should remember that 99.9% of cases in the country are from the Delta variant. Delta continues to drive cases across the country, especially in those who are unvaccinated. Getting vaccinated if you have not already, and getting a booster dose if you are eligible, are the most important actions you can take to protect yourselves and those around you. And with the availability of vaccines for everyone ages 5 and over, we are in the best position we have been during this pandemic to keep our children safer, our families safer, and our communities safer. You may not know that before I accepted the honor of leading CDC, I served as the chief of the Division of Infectious Diseases at Massachusetts General Hospital. I will never forget the moment that my pager went off, March 6th, 2020, a Friday morning, alerting me to the first case, indeed cases, of COVID-19 in our hospital, and how everything changed after that. Our hospital was quickly overtaken by the pandemic. As we worked frantically, I was constantly thinking through how we could reach underserved communities, incorporate evidence-based guidance into our treatment, and how we would eventually deliver vaccines. At the core of each of these decisions was how we would do our work equitably. When I came to CDC in January, almost a year after the start of the pandemic, I immediately made it clear that the same principle, health equity, must be at the core of everything we do. In April, 10 weeks after becoming CDC director, I declared racism a serious public health threat that directly affects the well-being of millions of Americans and, as a result, affects the health of our entire nation. I am committed to bringing my passion and advocacy for equity into all of my work at CDC, just as you bring your passion for equity to your advocacy every single day. The national movement for racial justice includes recognition that we cannot be healthy as a nation until everyone has access to health care. As President Johnson noted, and as the NAACP has recognized, the pandemic has made long-standing health inequities in communities of color even more visible. We cannot let our country's complicated racial history follow us into the future. The memory of historical medical abuses of the Black community in this country and the proliferation of misinformation about the effects and safety of our COVID-19 vaccines has meant distrust of the vaccine remains widespread. The distrust also stems from discrimination still faced today, caused by inequities in access to health insurance, healthcare facilities, and treatments, making it more difficult for Black Americans to obtain care. Know that I see you, I recognize you, and I express my sincere gratitude to each of you for the work you are doing. I am truly grateful to have been invited to speak with you this evening. Thank you.
Thank you, Dr. Rochelle Walensky, the Director of the Centers for Disease Control. And tonight we're talking the truth about COVID. And I want to bring on my co-host for this evening, someone who is a host and a commentator, someone who is committed to the truth when it comes to this deadly disease, someone who we saw publicly show what happens when you are infected by COVID. I want to bring on none other than the fabulous, fantastic, my friend, D.L. Hughley. Hello, D.L.
Hey, good evening, April. And listen, I didn't mean to show everybody what COVID was like. I just passed out because I had a book to sell. That was really. But I'm very glad to be here, and I'm saddened, like the doctor referred to earlier, that we still find ourselves in a situation where it seems like we're kind of standing still. So it's important that we have these kinds of conversations on an ongoing basis because things are so fluid and they change so frequently. And I think people allude to this all the time, how deadly not getting the proper information is,
Yes.
and how detrimental it is to our communities in particular. So it's really an honor to be here.
Well, it's an honor to be by your side talking about COVID and trying to protect the community, particularly our community that is so underserved and so woefully behind when it comes to issues of COVID. And I want to bring forth some of the names that we have tonight. Dr. Cindy Duke, MD, PhD, FACOG, Dr. Gigi L. Bayumi, MD, professor at GWU, George Washington University. Also, Dr. Cameron Webb, White House Senior Policy Advisor for COVID-19 Equity, will be joining us a little later on in the program. So, DL, I'm going to let you ask the first question tonight.
What do you think? And good evening. It's a pleasure to see everybody. And thank you for giving us a little bit of your time. I think we allude to this all the time, but I think it's just now kind of cliche to a lot of people. How negative? What are the negative impacts that have come as a result of just being this dearth of misinformation, particularly aimed at misleading members of our community? How detrimental exactly is that?
I can take that. It is deadly. I mean, it is causing people to die. I think, frankly, you wonder if it's not even deliberate. In some cases, what I've called what's happened in Black and Brown communities, passive genocide. I think at the beginning of the last administration, there was a calculated risk. They said, who's dying of it? Older people, poor people, people of color, people with pre-existing conditions. So why should we care? So misinformation, disinformation is deadly. People pay the cost with their lives.
But I think
So the next
as a
question,
community,
go ahead. I'm sorry, DL.
as a community, there, and you hear this often, we do have cause. Communities of color do have cause to question both the medical apparatus, the government apparatus, the private structure. So there are reasons that our communities have to be distrustful. But how do we disengage from the things that have historically been appropriate and the things that aren't now. Because there's, and I'm sure you hear this all the time, you'll hear the Tuskegee experiment ad nauseum, which I don't think is quite apropos to this situation. But how do we disconnect from what historically happened to what, and how did it, how is a differentiation between what happened then and what's happening now?
I'm glad that you brought that up because as a member of the Black Coalition Against COVID, with the Ad Council, we've actually done the Tuskegee project and have heard from the descendants of the Tuskegee trial and how they actually helped to dispel the often misunderstood myth that people were injected with syphilis, which is not true. People were prevented, were not given the treatment for syphilis. But you bring an excellent point up. There is a lot of distrust, not just for historic reasons, but frankly for ongoing reasons. During COVID, I've seen Black and brown people not get the same treatment as their white counterparts, not being offered the standard of care, not being offered the monoclonal antibodies, for example, and sent home more often. So I think, as my friend Ms. Cora Masters Berry, the former First Lady of Washington, D.C., has said, and of course in a much more down to earth than I'm going to say it, look who is in line getting the vaccines. Because if there was an issue of the vaccines not being safe or that these were not protecting people, white folks wouldn't be in line. But I think another source of trusted information is look at who the sources. So Black Coalition Against COVID, please check out the website, blackdoctor.org, the National Medical Association. So the sources matter.
Sources do matter. So I want to go to Dr. Dr. Duke. And before we go to Dr. Duke, Dr. Cameron Webb from the White House is here, the White House Senior Policy Advisor for COVID-19 Equity. Hello, Dr. Webb. How are you?
Me, and sorry,
Okay,
I'm a little bit late.
There you go. Unmute yourself. How are you doing?
I'm doing well. Can you hear me?
Yes, I can hear you now. So I
All
want to
right.
go to you, and then we're going to run to Dr. Duke, and then we're going to go to callers, callers as well as those on social. *3 if you have a question, and also go to @NAACP on Twitter or on Facebook or on Instagram. Dr. Webb, we are now in the midst of Omicron. We are still suffering from the Delta variant. We understand that we have to be fully vaccinated, but the full vaccination is now waning. We need a booster. It's a lot going on. We need a booster to fight what's going on in the midst of everything. Talk to me about where we are and the messaging, because some people are still not even there at getting fully vaccinated, and now you need that third shot. Talk to me about that.
That's right. Well, first off, I think that you just want to acknowledge there's been so much that's gone into us as a community getting to the point where we are. When I look at the numbers in terms of vaccination rates among adults, the fact that we have around 4 out of 5 Black adults in this country who've had at least one shot of a COVID-19 vaccine is truly remarkable. But that's only possible because of the leadership and the work of community members and leaders, faith-based organizations, barbers and stylists. The work of the entire community to make sure that we're protected against viruses had a disproportionate impact on communities of color since the beginning. And when you see something like Omicron coming, and you see the information that we know that it's got all these mutations. We know a lot of mutations on the spike protein. We know that that it has the risk of being able to potentially spread faster. And we're still learning about how severe the disease is. We're still learning about how effective our vaccines are. What's clear is that our community has learned how to rally around ourselves to make sure that we're able to make it through. I think that's one of the really compelling things. And so when we look at this moment, and you mentioned boosters, the data is pretty compelling. There's early data that just came in from Pfizer yesterday that showed that for folks who have booster shots, who've been fully vaccinated and have boosters, they have pretty much a normal level again when compared to all the other variants of COVID-19. normal level of antibodies ready to fight the second you get in contact with that virus. And that's a big deal. So having those neutralizing antibodies makes a difference. It prevents symptomatic illness. And so I think for us as a community, what's really been the key over the last several months has been sharing truth, hearing that from local trusted messengers, from the experts who you know, who you've worked with or engaged with for years, and being ready for the next challenge. I think that's the way that we make it through. But you're right. I think on the boosters conversation, we will not give up on that 1 out of 5 Black adults who's still not vaccinated. We have to continue to do that work. We've got to make sure that our youngest folks in our community are getting vaccinated. That's those teens, 12 to 17, who we've been trying to work on the past several months. And now our babies, the 5 to 11-year-olds, like my 2 kids, who just got their second shot last week, we've got to get them vaccinated too. We have to have an all-of-community effort to make sure that we are ready to weather the storm of whatever may be coming our way.
Whatever may be coming our way. Dr. Duke, Dr. Kizzmekia Corbett, the lead researcher on Moderna, the woman who made Moderna, said it's not if but when you will get COVID. And with that said, it's devastating the community. We are talking about this, it's waning. But when we talk, it's waning it'll wane at a certain point. We have to get boosters, we're being told, at 6 months. But at this point, what would you tell those who are still saying, I'm not going to do it? It doesn't work. I mean, we are at a critical point in time where people are losing their lives. And I say that as people who have been vaccinated, we're seeing it wane. They are now being hospitalized. And some of the largest numbers we've seen before. Vaccinated people are getting breakthroughs and going to the hospital. What do you say to these people in the midst of this?
I think the first thing I say is also to emphasize that when we talk about the devastation in our communities, it's death and, right? Because there are many people who are arguing against vaccines saying, well, the death rate is 1%, 6%. Many of these numbers are actually very low, what they're claiming when compared to the actual numbers in Black and Brown communities. Specific to what we're seeing in the devastation, we're seeing people losing work. We're seeing people with long-term chronic illness. We're seeing people with increased rates of diabetes. We're seeing families who, because the breadwinner became ill, maybe even hospitalized, they're unable to keep a roof over their head, keep food on the table. So when we talk about vaccination and booster shots, we're not just talking about saving lives. We're talking about saving your livelihood, saving your quality of life, saving the quality of your community's existence. And I think it's important for people to hear that. For those who are disturbed by the idea of needing a third shot, this is not uncommon for vaccination against viruses in general. The truth is, prior to 200 years ago, we didn't have very good ways to fight off widespread pandemic or epidemic viral infections. Immunization is what changed that path for us. And it dates all the way back to even the Revolutionary War. George Washington had to get his troops vaccinated against smallpox in order to prepare for that big battle as they crossed the Delaware. We need to know this stuff, and we need to be aware of the fact that, for example, when we talk about Tuskegee is only true if we withhold the vaccination from ourselves. And so there are people out there actively misinforming us, disinforming us, meaning they're actively choosing to give us the wrong information to scare us using our history, our rightful fear of our interaction with healthcare by telling us misinformation about Tuskegee. But the truth is, Tuskegee was where the government knew of something that was effective against treating syphilis and withheld it from Black men. We know these vaccines are effective. We see how it works, and we see how the boosters work, even in the face of new variants. And I agree with Dr. Corbett. It's not if, but when. And if you're not vaccinated, if your vaccination is waning, you are possibly the newest source of the next new variant of concern. Get vaccinated, get boosted.
Wow. DL?
Well, it's interesting because I remember when I contracted COVID, they didn't, I had no idea of the, of course, like everyone else, I'd heard about this strange disease, but I remember contracting it. And then this I remember having to go to the doctor over and over and over again with my blood pressure would just drop and my heart would race off, and I don't know how many times I passed out, and no one could tell me what it was. No one for months and months. And it got so bad, and I said this before on another show, that I thought about ending my life. I'm like, I'm not going to live my life like this. I'm not going to do it. It's just, it was too much. And so then I heard about long haul COVID, which they didn't even have a definition of. Nobody knew what it was. They had no idea. So you would go to these doctor and endocrinologists, you would go to pulmonologist, you would go all these doctors trying to get a diagnosis. And finally, when they started to understand that it could be COVID related, because no one it's such a novel virus, nobody knew what it was. For me, well, initially in my I didn't just infect me, I infected 10 other people that I work with, and one being my son, who has to go to a cardiologist because his heart remains inflamed, and another person that I work with who didn't have high blood pressure and diabetes and now does. And so we have no all the things that this impacts us, all the things that it does to our body, the different systems in our body are really kind of unknown right now. But we do know that it has far-reaching implications other than what you just alluded to, which was just the sickness and getting over. Because a lot of people believe, well, it doesn't kill everybody, or it's like the flu and you get over it. I don't know how many people now are on oxygen and whose lives are altered forever, like literally forever. And so I think we really need to ascertain and to start dealing with it. There was a very basic truth. It does exist. It is damaging our communities disproportionately. And there are far-reaching implications that we haven't even quantified yet. So we need to understand that you need to, when you're making a decision, you can't be one that's just made for right now. It could be for the long time and even in perpetuity in terms of your life. So you need to understand and base that information on sound, reasonable medical advice, and not some dude on the internet who tells you alkaline water will fix it all. Wow. So I think there's just this dearth of misinformation where, like I'll hear, 4 out of 5 doctors say that took it, and they'll always point to the one that won't take it. It's like when they did those Dentyne commercials, 4 out of 5 dentists. Like, so I think there is a need not only to just misinform, but to be right, and we're risking other people's lives, and that to me is where I see how harmful this is, because we're impotent with distrust, and it's really that thing. A friend of mine, a real good friend of my family, didn't take the vaccine, spent 3 months in the hospital, and now is going to be in long-term care for the remainder of her life. And I don't think there's a way that and these are people that we had conversations with all the time. And you often hear about people who say, had I known then what I know now, I'd have made a different decision. I think our charge is to get them to make that decision before it's too late.
Poignant firsthand experience from D.L. Hughley. Wow. I mean, the doctors will tell you things, but when you hear from someone like DL, it's like, my God. Abba, let's go to the phone lines.
April, we have Catherine Jackson. Catherine, you're on live. Go ahead with your question.
Hello, everyone. My question is, when will Moderna be fully approved by the FDA? And do we have to be concerned if you have taken, the Moderna shot and it not working?
Dr. Webb, I think we're going to throw that to you, but just out of transparency, I had Johnson & Johnson, and Dr. GGL Bayumi can attest to this because she is my doctor. I had Johnson & Johnson, and I was upset about Johnson & Johnson, and I wanted to choose between the two, and I went for Moderna, and I got my booster with Moderna. So there are people who are using Moderna. Moderna is said to be number one, followed by Pfizer, and then Johnson & Johnson, according to research. But Dr. Webb, let's let you handle that question.
Sure, sure. So, and first off, wanted to say hi to Dr. Albayumi. Good to see you. We haven't talked in a couple of
Good
months.
to
So
see
good to
you.
see you.
Thank
So,
you.
so I think, when it comes to Moderna, the first thing I always tell folks is we have, that's a vaccine that works really well. We have an overwhelming amount of data, tens of millions, hundreds of millions of folks who've had access to these vaccines. We've seen the impact, we've seen the value in terms of its safety and its efficacy. I think that we all love to see that full FDA process, but I want to be clear that timeline is really driven by the company itself and then going through a really extensive and rigorous process. And so we don't know exactly when, but I don't want that to detract from the quality of that Moderna vaccine. That quality is tried and tested. We have seen that in the field, in the real world, saving lives. And so, I know there were a lot of people who were waiting to see when are these vaccines going to get that full FDA approval. They were glad to see the Pfizer vaccine get full FDA approval. I have family members who I love just as dearly, and they have had Pfizer, they've had Moderna, they've had Johnson and Johnson. All of them have been benefited. They've all benefited by having these vaccines. So that's the first thing. So don't know exactly when. We know that it's kind of in that process. There's a tremendous amount of data that FDA goes through to make sure they give it that kind of gold standard stamp of approval. But I think even now, I would say I would bet my life on the value of that Moderna vaccine saving more and more lives every single day.
But Dr.
And
Webb, what about the people? What about the
go
people
on,
who
dear.
question the fact that it hasn't been FDA approved as a reason
Yeah.
to not take it? And people will oftentimes bring up the fact that you can't sue any of the makers of these vaccines as a reason as to doubt the doubt for its efficacy.
Well, and I think that that's where I say I just go back to the data and I say, well, if we look at the millions of people who've had the Moderna vaccine and we look at the benefit, we've seen the efficacy of the vaccine and we look at the safety profile, that's the reason why I feel so strongly about it. I think that what people are doing is they're getting really, mired into this rigorous FDA process that literally no Americans have ever paid close attention to before. And I'm not begrudging anybody for doing so, but what I'm saying is that the process for even emergency use authorization has a level of rigor to it. And I think that's why we were feeling pretty confident about the safety profile and the efficacy. That's the reason why, as it went through the different committees, both at the FDA and the Advisory Committee on Immunization Practices at CDC, they both felt pretty confident in the safety profile and the efficacy profile. So people's ability to sue is one thing that's entirely different. But if we're asking about FDA approval with regard to how it reflects on safety and efficacy, I would say, we all feel really comfortable betting on the safety and efficacy of the Moderna vaccine, right? And in terms of the process piece, in terms of what it means to have full approval, we're eager to see it get full approval as soon as all that process plays out. But one thing I want to be clear on is that process is it's a lengthy process for every medicine, every vaccine that's ever gone through it. And I think that's a good thing. That rigor that goes into it is the reason why we're able to have so much confidence. And so we have every confidence that Moderna will get that full approval. But I think that it's just a matter of saying, let the process play out, and it will. And I think it's going to reflect what we already believe, that these vaccines are really safe and effective.
And before we go to the next question, let's go to this piece. Dr. Kizmikia Corbett, the lead researcher for Moderna, Black woman, said that the process to make Moderna was years in the making. It wasn't just something that happened like in a couple of weeks before they put it out. She said that it was a protein on her screen for a long time before it became reality. And it had been in a process for years. It wasn't just something that just happened now in the midst of COVID. So we need to be clear about that as well with that process. And the process, am I correct, doctors? RMNA?
mRNA.
Messenger
mRNA.
RNA.
Yeah.
Messenger. Okay.
I just,
Okay.
yeah. If I could add one thing, the Moderna vaccine works, by the way. So I know the caller said it does not work. That is incorrect. The Moderna vaccine works. It is highly effective. Not only is it working well in the 2-dose course, it works extremely well as a booster. And I speak for myself. I got the Pfizer 2-dose vaccine series and elected to boost with the Moderna vaccine.
Can I ask you something, Doc? Because this is something that's interesting to me. What people will point to, like they'll always tell you that. I mean, I'm just, I'm on the radio every day and we're talking to millions of people, and one of the things that is consistent, kind of the mindsets is they don't tell you all the people that died as a result of the vaccine. One of the things about in America is that we're pretty bad at math. Like, we can't be this misinformed and this horrible at math. Like, so in relation to, there have been almost pretty close to 200 million Americans who've received one or more doses of the vaccine, right?
Correct.
And we have breakthrough infections that have resulted in hospitalization, and some that is related in death. So as a practical matter, how would you, because what people will always talk about is the fact that we don't ever mention the people who've died as a result of the vaccine, or died even though they had the vaccine. What is kind of the overall impact of, we know how many people have gotten it, we know how many people have been hospitalized, how many people have died. Mathematically, how does that look?
Yeah. Well, I think mathematically we should say that billions of doses of vaccines have been administered around the world at this point. And the deaths that were actually due to vaccine are actually less than a handful. When I say a handful, I literally mean so some people have underlying illnesses, right? They may
Sure.
have diabetes, heart disease, cancer, and in the course of their disease, they also got vaccinated and they progressed with their disease, or they became exposed to COVID and succumbed to COVID because they had this severe underlying illness. That is not a death from vaccine. And I think
Sure.
many people out there are confusing that. And so that's the first thing, to be clear. And, we use the term causation does not equal correlation and vice versa. And I know that confuses people, but it's like if you went out on the street and you were walking and you crossed when the light was red and you got hit by a car, it doesn't mean that walking caused you to die. It was because you crossed when the light was red. There was another factor at play. And that's important to know.
Mm-hmm. All right.
So don't walk when you're taking Moderna. Is that what you're saying?
Using the
Oh dear.
yeah,
I'm just asking.
Using the car analogy. So we all agree that seatbelts save lives, right? There may be one time in millions of lives saved where a seatbelt actually prevents you from getting out of the car and actually results in your death. We don't say then that seatbelts kill people. So I just also want to be clear about what was said, because even if people get breakthrough infections and have been vaccinated, their chances of dying or ending in the hospital is significantly lowered. So, it is very hard to get your head around numbers when we're talking millions and billions. But the risk of dying from the vaccine itself, and please, for those of you that may know the statistics better than me, is less than 0.001%, exceedingly low. But I think that seatbelt analogy may be helpful for people to think about it. Seatbelts save lives, vaccines save lives.
And
Those
if I may
numbers
add,
are
lastly,
exceedingly low. Go ahead.
yes, and as a virologist and vaccine immunologist, a person who spent years designing vaccines against viruses, it's important to know that when you design a vaccine against a virus, we're not designing it to prevent infection. It's to prevent severe illness and death. And so I know the word breakthrough infection has lots of people confused and thinking that this means the vaccines aren't doing what they were intended to do. But none of these vaccines were, in terms of their clinical trials, the trials were not designed to look at whether people primarily didn't get infected or got infected. It was specifically, were we preventing the worst case outcomes, which is hospitalization and death? And these vaccines are incredible at that, way better than taking your chances, way better than simply saying, I take good care of my health by eating well and exercising. It works well. You still need to wash your hands, eat healthy food, wear your mask, but the vaccines are the most effective at preventing hospitalization and death from COVID.
Okay, so we're going to go to the phone or go to the questions from social. Abba, because that's what we're going to do for the rest of the evening. We've got thousands of people wanting answers.
Yep, we have Cecilia Haley. Cecilia, go ahead with your question.
Hi, good evening, panel. My question is kind of twofold. Now we had Delta, we have Omicron. Are we going to go through the whole Greek alphabet, and you plan on vaccinating us with a booster every time there is a new variant? And also, you didn't really tell us the truth that the vaccine only lasted about 6 months, because if the vaccine was effective, we wouldn't be getting boosted.
So let me, okay,
So that's
we're gonna go
actually
to
not about truth.
Yeah.
Can I just say something about truth?
Yes.
So thank you for the question. It feels like you're not being told the truth, but the reality is, I make the following analogy. When there is a hurricane and we're hearing about it and preparing for the storm, we always say, stay tuned for updates, because we don't know what the path of the hurricane is going to be. It may be going one way, but it decides to go another way. So it was not that we lied, we didn't tell the truth, we didn't know. That's very different. That's not to say that I don't hear your frustration. Part of what has made it very, very difficult for all of us as human beings is a lack of control. What is next? We could have planned. If we were told you're gonna be okay after 2 years, or this is the date that we're gonna take off our masks, it would have been hard, but at least we would have had a date. So I appreciate your frustration, but remember, we're learning, we're learning as we go and updating the protocol as we get more information. And the best way to prevent variants is for people to get vaccinated, because the more people that are unvaccinated, the virus turns our bodies into a COVID manufacturing plant where millions of viruses are created. And that's the time when they can come out with all these different variants.
Very
Well, I just want
important. You
to.
said we don't
I want
know. You said we don't know. And that's very important. And Dr. Fauci even said that they don't know as of yet if this will be like a flu vaccine where you would get a vaccine yearly. So I think Dr. Elbayumi, you said something poignant. We don't know.
Yeah, and just
Dr.
really quickly, wanted to add, and I think I'm so glad Dr. Duke is here because we got some real expertise on this particular matter. Want to be precise and give some data. So with regard to the Delta variant, since that became the dominant variant here in the United States, which more than 99% of our cases are, the vaccines themselves, for folks who are fully vaccinated, they have a 5 times lower risk of infection and an over 10 times lower risk of hospitalization and death. So going back to Dr. Duke's point, that is a particular value that these vaccines have already offered. And what a lot of people are pointing to in terms of how well the vaccines work or how long they last are circulating antibody levels. And I'm just a country doctor, so I'm not a virologist. I'm an internal medicine doc. I work on a COVID unit. But what I can tell you about that is an example that one of my good friends, Dr. Tyson Bell, uses about circulating antibodies. When you come into contact with the virus, those neutralizing antibodies can attack the virus right then and there and stop it in its tracks. That's the value of neutralizing antibodies. Boosters get your neutralizing antibody levels up high enough to really protect you in that way. But even if you didn't have that, for fully vaccinated individuals, what they still have is the immunity that their body creates. When you get vaccinated, you have that level of immunity, and that's going to help protect you from getting that severe illness, that hospitalization and death in many or most cases. And so the way to think about it as an analogy, it's like a castle with a moat around it. The moat are your circulating antibodies. The castle walls are your body's immunity that you develop after vaccination. When those circulating antibodies levels get low enough, it's like the moat is drained. And so the virus can get through that first line of defense, but for most people, they still have that high wall to protect them. So it doesn't mean the vaccines are no longer effective. I want to be clear about that. It just means that you have lower, often undetectable circulating antibody levels. And the reason why we're saying get boosted is because with the amount of virus we have circulating in our communities, the level of spread, the fact that we're still in this pandemic with new variants, you want to have the most robust defense available to you. You don't want the moat to be drained. You want to be well protected. And that's why we're telling folks to get boosted. At every step along the way, we're looking to the science to say, how do we give people the best chance to stay alive through this pandemic that's taken so many lives? But I don't want to talk out of turn. We got an expert in Dr. Duke who could probably clean up what I messed up there.
But
Doc,
I think you did great.
In terms of the way people, the frustration that people have, and I do think that there was a messaging problem. I really do, because a lot of people got the impression that when you heard about the Johnson & Johnson, it's one shot. Like you heard, or maybe it's 2 shots for this. We're going to be able to spend, we can take our mask off. There was that, there was that big announcement, you can take your mask off. And I know that those weren't intentional, But those kinds of things start to erode trust in the fact that people might not know what they're doing. And if you don't know what you're doing in that aspect, and I'm fully vaccinated. I've taken 2 Moderna shots and just got my booster. So in my entire family. So I understand, but I also understand when we've been made, and maybe not deliberately, but some very uh, bold statements and some very bold promises, including somebody from the CDC coming out, take your mask off if you're vaccinated. Those things turned out not to be true, and it did erode trust.
I agree with that. And I would tell you, I disagreed with coming out and telling everyone to take their mask off. I also disagreed with telling people that boosters wouldn't be needed, because the truth is, the way viruses work, pretty much every vaccine we have against viruses require periodic boosters over time. So the flu shot is the one we're most familiar with because we do that on an annual basis because of how quickly the mutations and recombinations happen. It's the same concept with SARS-CoV-2 and how it's traveling the world. But we also get boosters for measles, mumps, rubella, the MMR vaccine, that's a virus vaccine. Shingles/chickenpox, that's a virus vaccine that we get vaccinated against periodically. I think as a general population, we haven't really been very aware of human existence and the role viruses play in our lives and the role vaccines have played in protecting us. We've been vaccinating babies against countless viruses and vaccinating them again before they go off to school, many times before they start elementary school, and again as they're heading to high school or college. But the people don't know the concept of boosters is the same. And so I do agree the messaging where people seem to think they were promised that there will not be a need for a booster was absolutely incorrect and probably led to people having less faith. But boosters, as Dr. Webb said, are necessary to keep the system at high alert when the threat level is still high. And make no mistake, the threat level that SARS-CoV-2 poses is still high. The majority of our world's population is still not yet vaccinated. You think of the farthest place in the world, it's only 24 hours plane ride away from us. We need to vaccinate not just ourselves, but our communities around the world and really get the rest of the world's immunity up so that we can keep these variants of concern from forming. For as long as there are large groups of people, whether it be in communities within the US or outside the US, who remain unvaccinated, we will have new variants. And therefore,
okay, we've got 8 minutes left, and we've got 8 minutes left, and we've got to take the rest questions because people are on here wanting to know. And if we can keep our answers short. Abba, next question.
We have Deborah Berry. Deborah, you're on live. Go ahead with your question.
Yes. Hi. I'm sorry. I wasn't. Yes, I have a question. Number one, how many boosters? I know that we're saying a booster now, but how many boosters? Because I just heard about 2 weeks ago that they were saying that the one booster, you're going to need another booster after that booster. And I also have another question. I feel like the government is lying to us in reference to how this virus is being spread. Because I do my own homework, and I know that HIV is a virus, and it goes through every orifice of the body. So I am, in my own analogy, now I'm not a doctor, but I'm thinking this virus is also being spread through sexual contact. Because it is a virus, it's going straight through the body, and the way it's spreading so fast, and they're not saying these things, and I know somebody directly very close to me who, his partner, she got the shot, he did not.
All right, Miss Berry,
okay?
thank you. We're going to get an answer for you because we got to keep on. Can you get this through sexual contact?
There's no proof that sexual contact transmission occurs, but keep in mind, if you're having sexual contact, you're in the same room, you're sharing the same air, so airborne.
I'll say, if you're doing it right, you are. That's for sure.
Oh my goodness. Anyway, next question, Abba. DL.
Let's go on to Claude Waters.
Okay. Hello?
Yes, we're
Keep your
here.
question
Hello?
so we can get more questions.
First thing I'd like to say, I'd like to thank everybody on the panel and the doctors and the medical staff and everyone who's been dealing with this pandemic on the front line. And my question is that I've had the virus, and I'm trying to figure out the steps or are there steps that should be taken that's agreed upon across the board as far as the follow-up? Once you've gotten it, you've tested, you're positive, you go relax. I've had the shot. And then later on, after I went back and got cleared and everything, they sent me a thing from the mononuclear bodies, the other follow-up medicine. Hello?
We hear
The
you, sir.
monoclonal antibodies. Mhm.
Okay, yes, monoclonal antibodies, that's correct. That came after I went back and retested and was cleared. And it appears to me that should have been something that should have come within the first, once I've been known to have the virus. But it was sent after from
Sir, so
on the
what is
link.
your question? What is your question, sir?
My question is there some type of order that things should be put in as far as follow-up from the time you get it all the way through, steps that should be taken to, as opposed to that you should have in front, not come in behind the information?
Thank you so much. Dr. Gigi?
Well, we know that compared to white patients, people from Black and Brown communities do not get offered monoclonal antibodies at the same rate. So if you're having fever, if you're having shortness of breath, if your oxygen is low, then you have to consult with your physician, clinician, to see if you're a candidate for the monoclonal antibodies. Those are given in infusion centers, sometimes in hospitals, and they do make a difference. In terms of overall follow-up, it really depends how you have recovered. If you're still having symptoms, difficulty concentrating, your blood pressure's high, you're still having palpitations, you're having depression or anxiety, then please try to get to a long haulers COVID clinic where they have multiple disciplines coming together to take care of you.
Thank you. Next question. Abba?
Ashley Gaines. Ashley, you're on. Go ahead with your question.
Hi. Sorry. So my question is, do you think that we will ever reach herd immunity, and will the virus continue to mutate if we do not reach herd immunity? Because we have so many states. Like, I'm from Alaska, so we have a governor and our city mayor that refuses to put a mask mandate in place and encourage people to get vaccinated. And right now we have the highest amount of cases per capita in the country, I believe, out of any state.
Dr. Webb?
I think the term that I'd prefer to use is community immunity. This is playing out at a very local level. So, the rates of vaccination in Vermont or New Hampshire don't really do you much good in Alabama, South Carolina, or Louisiana. And so I think the important thing to know is, what does the vaccination rate look like in your community? What is the level of immunity in your community? That's going to be somewhat protective. But I think Dr. Duke said it well. As long as the rest of the world remains unvaccinated, we continue to have threats, and we always have the threat of a variant that can escape or evade our immunity that's provided by the vaccines or the monoclonal antibodies, whatever it may be. So again, the threat remains high. I think the key is making sure every community is reaching that level of high immunity that stops the virus in its tracks.
Abba, next question.
Yes, we have, let me see, Andrea from a 720 number. Andrea, go ahead with your question.
Hi, yeah, I just would like to know why is it you guys aren't saying anything about natural immunity and some of the ways that we can kind of help ourselves in that capacity. And the other thing I'd like to communicate is, one of the reasons I think we sometimes have a trust issue is because this conversation is so one-sided. And I felt kind of insulted when you told me because white folks were getting it, I automatically, as a black person, should feel good about getting it. I don't do
So,
things
Andrea,
because
let
of
me
white
ask you
folks. I
this.
do
Okay,
things because
Andrea,
I know
we
it.
want to
So
include
thank
you.
you.
So, Andrea, you are against vaccinations. Am I correct from hearing what I'm hearing?
No, I'm not against vaccinations at all.
So, but you're talking natural immunity. What is it that you
Yes.
want to know about natural immunity as it relates to the deadly COVID virus and its variants?
Well, the thing about it is, I just want to know: is there a natural immunity? We seem to only have vaccine, 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 and I think the other problem that I have is that you're telling us that the Black community isn't getting the shot. Well, for the next 5 years, give us supplemental health coverage, and then we'll trust that you really do want us to get the vaccine. Like, the only thing is, you're spending billions of dollars on a vaccine, but you guys won't spend billions on getting us health care, because a lot of people who have died, from my understanding, are people with underlying health conditions. So we're not talking about dealing with those underlying diabetes, overweight,
But
things
everyone
of that
who's died
nature.
is not someone who's had underlying conditions. There are people who were healthy that died, young people who died. So we can't just say it's one group. And I want to let all of the doctors, if they can, or whichever one. Yes, go ahead, Dr. Duke. Answer her question
I'd
on
love to
natural
answer
immunity
Andrea.
and health
Andrea,
system.
yeah. So, the 702 area code is actually my area code here in Las Vegas. So, Andrea, I hear you. But here's the thing about when people use the word natural immunity, the immune system is actually very broad and has very specific roles. Without teaching it what the offender is, it doesn't know how to fight. And that's what vaccination does. It teaches your immune system what the threat looks like without you getting sick as a result. So I know there are people out there who are asking, why not just expose everyone to the virus and let the chips fall where they may? Well, we kind of did that in the beginning, and now we have over 700,000 dead Americans and millions dead around the world. We can't just let people wait to see what their immune system does against the actual virus. You need a vaccine so that you're prepared and you can clear the infection before your body becomes overwhelmed. Secondly, when it comes to the question of what we call social determinants of health, we do not disagree with you. I think everyone on this panel agrees with you that we have to do better with insurance coverage. We have to do better with the way we provide nutrition and nutrition education in schools, and for families to have access to healthy and nutritious foods throughout the country. And I can go on and on about all the other social determinants of health in terms of, living wages, giving you access to great neighborhoods where you can live and breathe clean air and drink good water. I agree with all of that. But right now, the threat is COVID-19. While we are working actively and fighting for all those things that you highlight so well, we also have to stay alive long enough to get those things. And that's where vaccines help us.
And if I can just add
And
quickly, Angela, just a quick point. Dr. Marcella Nunes-Smith, who's one of our colleagues, she's been leading the COVID-19 Health Equity Task Force. They released a report on how to not just address the inequities in COVID-19, but also this broader systemic inequities that created the disproportionality we've seen with COVID-19. So I do encourage you to check that out. It's the President's COVID-19 Health Equity Task Force. Their final recommendations came out last month, and we're working to implement those now. But certainly hear your concerns.
Mm-hmm.
So I would
Well,
also finally add that please visit the Rodham Institute, which is dedicated to improving health equity in DC. And you're absolutely right. The medical system only accounts for 20% of life expectancy. So if we just focus on even the medical system, that's not going to be adequate. But the reason that there are disproportionate numbers of Black and Brown people dying from COVID are the same reasons that there is disproportionate deaths from diabetes and so forth. The only thing that I mentioned in terms of the monoclonal antibodies, if we consider that the standard of care in saving people, just like the standard of care for a catheterization with a drug-eluting catheterization for a heart attack, it's not being offered in the same way. So people can refute, but at least it should be offered at the same level between groups of people. That was my point.
And even if you look at the mortality rate when women of color have children, and how just having a person of the same, like just having a Black healthcare worker for a Black woman, that increases her chances of having a successful outcome exponentially. There are things inherent in our systems that we just get a greater, we get less care. And the other thing is, we've talked to people ad nauseum about the choices they make in food. And obviously in our communities, it's an average of 17 miles. We have food deserts. But there is this idea that all of a sudden you can ramp up your immunity system. We're in the midst of a very deadly pandemic. Ramping up your immune system now is like putting on your seatbelt after the airbag went off. That's a conversation we can have, but you can't have that conversation. All those things would have been something that were proactive. We have to be reactive now because the virus is here and it seemed to be mutating and going in all kinds of directions. So we have to decide on something that's going to get us where we need to be going forward.
Well, this has been a very robust conversation with a lot of thought-provoking messages. And once again, thank you everyone for joining us for this National Town Hall, COVID No More. We still are in the midst of trying to find out about COVID, and we invite you to learn more through all of the panelists who have platforms that you should take a look at to find out more. And we thank the NAACP for doing these conversations, to being a part of helping us understand, to survive, to live to see another day. I want to thank my co-host, D.L. Hughley, DL. Hey. Dr.
And do not cross the street after you take Moderna. Don't do that. She just said don't cross the street and take Moderna. And when you have sex, be in the same room. That should be that.
And like the what? What did you just say?
I said, and when you are having sex, be in the same room.
I'm done. DL is right. I think this weekend DL is in Louisville, Virginia. If you want to go see him, you can hear his jokes. Anyway, thank you, Dr. El-Bayoumi, Dr. Duke, and Dr. Webb. Thank you so much for joining us for this National Town Hall. COVID No More. I'm April Ryan, White House correspondent and Washington Bureau Chief for The Grill. Tune in to Grill.com, thegrill.com for more information on this and other stories that pertain to you. And Abba, I think you've got a PSA for us to take a look at and nourish our minds about COVID with.
Scene 103, take one. Taking my vaccine and staying safe. That's what you want me to believe. Of course. They're saying that the vaccine is 99% effective, right? Where are you going with this? What about the one dude? I want you to get the vaccine because I care. I want you to be safe. If you was to die, man, that would literally kill me, man. If it made you feel that way, bro, I would probably do. I love you. I love you too.
Good night, everyone.
Good night.
Questions, you can go to naacp.org/COVID No More or getvaccineanswers.com for more information. Thank you again for joining us and have a great evening.